COVID pandemic is very much still here. While the case counts, number of people in hospitals, number of people who've died have gone down over the past few months, it has effectively leveled off at this point and is likely to rise in the near future, which means that if you have not gotten your vaccine, if you have not gotten the most recent bivalent booster, now would be a great time to do it. Not only for your own safety, but also for your bank account, because Pfizer has announced that it's soon going to be doing a markup on the vaccine. For uninsured Americans, it's going to rise by about 10,000%. Let's give you all the information. So once the US government uses up the doses it's already bought, which we've been burning through, that's expected to happen sometime in the first few months of next year. Pfizer is gonna raise the price to as much as $130 for a single dose of the vaccine. So apparently, Angela Lukin, executive at Pfizer, said that they expect that the vaccine will be made available at no cost to people who have private insurance or government paid insurance. Lukin did not say whether the company will make any accommodations for the tens of millions of people in the US without any health insurance. I'm gonna say we could probably guess. I think, maybe I'm wrong. Anyway, the cost of producing the vaccine is estimated to be as low as $1.18 per dose. The US currently pays around $30 per dose for Pfizer's shot. So they were already making a tidy profit and they're about to raise the price substantially.
Remember Martin Shkreli?
Yes.
Do you know how much he hiked the price of his?
7 times or something?
5,000%.
Oh geez.
And remember, everyone said that Martin Shkreli was the most evil person in the world for raising the price 5,000%. This raises it 10,000%. Now, by my reading of it, we covered this in Unbossed earlier this week. Everyone watch Unbossed every weekday at 1 p.m. Pacific, 4 p.m. Eastern, youtube.com and facebook.com/unbossedtyt. It seems like it's a $10,000 above cost asking price. 10,000% above yes. How much it costs. So they're making a 10,000% profit. And so we went through and we're like, imagine if other companies priced their products the way Pfizer is pricing.
I love it already.
So at the launch of the dollar menu, McDonald's was charging $1 for something that they made a 4% profit on. And so, a 6% profit on. And so that is the equivalent of when they launched the dollar menu, McDonald's had the $94 menu. Charging this much based on what it costs them is like McDonald's charging you $94 for a double cheeseburger. And when their executive shows up and that executive says, oh, you know what, won't cost you anything if you have private insurance. Yeah, but they're still getting paid for private insurance.
Yeah.
It's all a scam. Your job is paying someone that much. And because of that dynamic, it costs Americans pay twice as much per person for healthcare. So twice as much as every other industrialized nation that has universal state-run healthcare. We pay twice as much for everything per person. And we die sooner.
Yep.
And it's because, and when you hear that this system is running at a place in a way where you can raise the price by 10,000%, you think, well, something's broken. Yeah. But the people who built the system say, it's working exactly the way we continually pay for it to work.
Well, at the very least, it is illegal for any of our politicians to invest in Pfizer. Or anything.
That's
they can't
not
invest
true.
in.
No, John.
No?
You're saying things that make sense to do.
Well, it shouldn't be legal. That's crazy.
Listen,
because they determine what's gonna happen. But yeah, no, of course. Look, it's absolutely insane. It's absolutely insane. And when you see that they're gonna be able to do this, the idea that there's gonna be any significant strike back against, gasoline companies doing some more price gouging, like they're not gonna do anything about that. The gas companies at least aren't gonna raise the price of gas by 10,000%, but there's seemingly no end, there's seemingly no limit. At the same time, by the way, the WTO has stopped the proposal to temporarily waive the patents on these vaccines, which would have helped generic versions of these vaccines be made in countries throughout the world, which, by the way, have not had nearly the access to vaccines that we have. As of right now, just 23.3% of people in low-income countries have received at least one coronavirus vaccine dose. And that's not because they unfortunately trusted Tucker Carlson and decided to go without. Many people would love to get it, but just can't right now. Pfizer is doing everything it can internationally to stop that sort of proposal from going through. Now, in the past, it has been the case sometimes where these companies will say, well, sure, we are charging way more than it costs to make these medications, but we had to develop the drugs in the first place. In this case, though, we paid for that too. I understand, not 100%, but we massively subsidized the development of these vaccines. So to then turn around after already making a massive profit and decide that we need to up it by 4 or 5 times is insult to injury.
Right, so with the other ones, we said, Operation Warp Speed, here's a bunch of money, please make it. That's so taxpayers already paid for it, okay? With Pfizer, all we did was buy a bunch ahead of time. If it works, we're gonna buy a lot from you. And so they essentially did, not the first one's free, but the first one's super duper cheap. And then when you realize that Pfizer's awesome, you wanna stay alive, don't you? Then they jack up the price by 10,000% over cost.
Yeah.
It's nuts, man.
Yeah, and bear in mind, like as you said, like if you have the insurance, you're still like, it ain't free. Look at your check.
Right.
You're paying into that.
Right, someone's paying me.
Yeah.
That's the thing, is like you just won't have to deal with the paperwork is essentially what they're saying.
You won't have to take your debit card out at CVS maybe. That's the only thing it's saving you.
And then the last thing for everybody to tell all their friends about how it works in America versus other countries, can we do this? America, we're number 1 at so many things, including among developed nations, the cost of prescription medication.
Yep.
Insulin, there's an ALS medication that's $140,000 per year to have. It's ridiculous. So many things are so far above price because other countries, they allow the government to buy wholesale. The other countries say, okay, I'm Japan. You want to sell any drugs in Japan? The government's gonna buy all the drugs for everyone. So we're Costco in this, as opposed to sending someone to a boutique store. And worse, the only part of the government that is allowed to collectively bargain, negotiate for drug prices is the VA, the veterans. And recently, we wanted a bunch of Medicare to do the same, but that got brought down to 20 medications by 2029. 20 drugs, Medicare only. That is absolutely, positively insane.
And it's especially weird because there are so many right-wing populist politicians. They must not know about this, or else they surely would have stood up for their constituents and fixed it.
Trump's the only one kind of saying it.
Yeah, he was also president for a few years, and he has absolute control over his entire party. One would think that if he really prioritized it, he could probably get them to do something about it.
And just the last little bit, when they made the collectively bargaining for Medicare illegal when they created Medicare Part B. So in 2003, they just made it illegal to collectively bargain. And they said, well, we think it's a better shot if Blue Cross, Blue Shield, Aetna, they're all going and doing the negotiations themselves. But anyone who's ever been to ballpark knows that if there's like 4 places to buy a hot dog and they all decide they're gonna jack up the prices, you got only so many people offer healthcare.
Yeah.
And they all are in it together, raising the prices on us. How do I have proof of that? It costs twice as much per person in America for healthcare, and we die sooner. That is how you win every argument about whether this competition situation works versus the government collectively bargaining on your behalf.
Good point.